Bill Doyle. I'm the President and Chief Executive Officer of Vystar Corporation. Vystar Corporation is an American company with 2 patents on a method to remove the antigenic proteins from natural rubber latex as a raw material. Significance of that for any individual out there that has a propensity for a latex allergy is that without those proteins in it, should you be exposed to latex, chances are you wouldn't develop that allergy if the proteins have been removed. You're probably wearing quite a bit of latex right now. Latex is used in 40,000 different products, anywhere from threads, adhesives, gloves, condoms, catheters, balloons, mattresses, foams, pillows. Latex is the predominant in adhesives, whether it is in the food preparation or in simple things like self-stick envelopes or napkin rings. Vitex starts off with natural rubber latex as soon as it comes out of the tree. I mean, natural rubber latex comes from the southeastern Asia. It's 20 degrees on either side of the equator. And Vitex takes that natural rubber latex in its most pristine form, and we apply our process to it to stir it and mix in a specialty group of chemicals. And then once centrifuging is done, which is part of natural rubber latex processing regardless, the top layer now becomes Vitex, and then the bottom layer, which is called the skim, is actually protein rich and it still contains rubber particles, and that's used in some dry rubber applications. What's been demonstrated in the past that if an individual has a propensity, an allergic reaction to the antigenic proteins in latex, repeated exposure will exacerbate that problem. 3% of the population has a problem with latex, even though we wear it every day in various different fashions. 17% of healthcare workers, and that's been reported as high as 20 and 30% of healthcare workers have the issue, mainly residing with the technicians, the nurses, and the physicians that wear gloves every day, or a surgeon who'll put a glove on and might have it on for 2-3 hours during a long-time surgery. They tend to develop the allergy because of that repeated exposure. Vitex can then be dropped into any manufacturing process where natural rubber latex is right now. So you can make a glove, a surgical glove or an exam glove, out of Vitex. You can make a condom out of Vitex. As a matter of fact, the company has 2 510(k)s that have been allowed by the FDA for each of those products, one for an exam glove and one for a condom that's produced with Vitex. You could produce any number of adhesives, such as those used in surgical dressings, those used in self-stick envelopes. You can also produce catheters, you produce balloons. Nothing holds helium like a latex balloon would hold helium, and Vitex can easily replace latex along those lines. Vitex can also replace quite a few of the petroleum-based synthetics that are being used as an alternative raw material in most of these products. Well, this is my second run at starting and taking a company public. This has been the most intimate because I've been in a much different role than I am when I did this the first time. My whole career has been in healthcare, and the need that you see with healthcare workers with their constant exposure to proteins in latex with exam gloves or surgical gloves or any other item that they would use that's made out of latex. Just being in the field and seeing what was taking place, some cohorts of mine went back to Travis Honeycutt, who's the creator of the process and the original patent holder, and said, okay, isn't there something you could do to try and make these gloves safer for the clinician? His original thought was, well, let's remove the proteins after it's been produced. But when we started to take a look at the market, we realized that it was a much broader market than just what goes into gloves or what goes into a surgical glove or what goes into a condom, that it's in threads and everything else. And so we just decided, let's take a look at how we can remove those proteins in a raw material state and then sell to those manufacturers. We didn't want to compete with people who were already doing an awful lot of marketing, have some solid contracts in various different areas and are well entrenched. So how do we work with them? And we came up with a way of being able to patent this process to remove these antigenic proteins in that raw material state. Well, Travis is retired. He had been, he's no longer a board member, but he's on there as an advisor should I need him. Sandra Parker is with us. She's got an extensive career in healthcare. Started off as an OR nurse. Worked with Travis and me as we were with the public company prior to this. And has got some really solid background with some of the major glove companies. Matt Clark. Matt's handled our patents from the start. He was one of the original researchers in the early process, and he heads up our technical sales group right now. Just starting. We're at the very beginning. Fourth quarter of 2009 was the start of the revenues, and we look forward then to a solid 2010, 11, and beyond. Well, as with any startup, and I still have us in that moniker there, it's always a risk. But from what we've seen recently, any foray into any part of the stock market is a risk. Vystar has now completed 64 different trials in various different manufacturing areas across 7 different industries, and hasn't failed one of those trials yet. So right now you would be getting in on the ground floor of what Vystar can do for the future as we work to close out those trials and then take a look at the next 64 and the next 64 after that.